So this is the viscera of the stomach with lower part of the esophagus, lesser omentum and the greater omentum. The cardiac end lies 2.5 cm left to the midline. The pyloric end lies 1.25 cm right to the midline. Anterior superior surface is directed upwards and forwards. Posterior inferior surface is directed backwards and downwards. The lesser curvature forms the right border of the stomach, which is concave. The greater curvature forms the left border of the stomach, which is convex.
Now, the external features. Stomach has two surface, two curvature and two orifice. This is cardiac orifice, this is pyloric orifice, this is lesser curvature, this is greater curvature, this is anterior superior surface and posterior inferior surface. The cardiac orifice lies 2.5 cm left to the midline, and it lies in the 7th costal cartilage, and vertebral level is thoracic 11 vertebra. Now the pyloric orifice lies 1.25 cm right to the midline, and vertebral level is to lower border of lumbar 1 vertebra or transpyloric plane. This is lesser curvature. This lesser curvature is concave and it gives attachment to the lesser omentum. This is greater curvature. Greater curvature is convex. It gives attachment to the lower 2/3 greater omentum, upper 1/3 gastrosplenic ligament, and most upper part gastrophrenic ligament. Now two surface, anterior superior surface, which is directed upwards and forwards. This is posterior inferior surface, which is directed downwards and backwards.
Now subdivision. Stomach is divided into three parts: fundus, body and the pyloric part. The fundus of the stomach is the most upper convex part which lies above the horizontal plane, which extending from the cardiac notch to the greater curvature. The body of the stomach which lies below the fundus of the stomach, and it separated from the pyloric part by an imaginary line which is extending from the incisura angularis or angular notch up to the greater curvature. The angular notch is the most dependent part of the lesser omentum or lesser curvature. The pyloric part again divided into two parts: pyloric antrum and pyloric canal by sulcus intermedius.
There are two types of relation: peritoneal relation and the visceral relation. First, peritoneal relation. Along the lesser curvature, stomach is related to the lesser omentum. Along the greater curvature, lower 2/3 related to the greater omentum, upper 1/3 related to the gastrosplenic ligament, and most upper part related to the gastrophrenic ligament.
Visceral relation. Now visceral relation. The visceral relation for the anterior superior surface, the visceral relation on the right side upper part is related to the left lobe of the liver, and the lower part is related to the quadrant lobe of the liver. On the left side is related to the diaphragm, and the lower part is related to the anterior abdominal wall. On the posterior inferior surface, it is related to the stomach bed of the structure which forms the stomach bed. So what are the structure in the stomach bed? আচ্ছা, ভালো করে বোঝার জন্য এটা আমরা anteriorly দেখাচ্ছি। তাহলে কি on the upper part diaphragm, on the mid side কি থাকবে? Spleen, left kidney and left suprarenal gland. Then pancreas, transverse mesocolon and the left splenic flexure or left colic flexure. Then along the lesser curvature, it is supplied by the anastomosis between the right and left gastric artery. This left gastric artery, which comes from the celiac trunk, and the right gastric artery comes from the hepatic artery proper. And along the greater curvature on the lower 2/3 is supplied by the anastomosis between the left gastroepiploic and the right gastroepiploic artery. And the posterior surface of the stomach is supplied by the splenic artery. Then splenic artery, there is a branch comes from the splenic artery, which is known as the short gastric artery, which supplies the fundus of the stomach. This short gastric artery is a branch of the splenic artery. Splenic artery is a branch of the celiac trunk. The left gastroepiploic artery is also a branch of the splenic artery. The right gastroepiploic artery is branch of the gastroduodenal artery. The gastroduodenal artery is branch of the common hepatic artery. Common hepatic artery is a branch of the celiac trunk. Celiac trunk is the branch of the ventral branch of the abdominal aorta. So what are the other ventral branch of the abdominal aorta? Superior mesenteric artery and the inferior mesenteric artery. What is the nerve supply of the stomach? As because it is a viscera or organ, it is supplied by the autonomic nervous system. So there are two components of the autonomic nervous system: sympathetic and parasympathetic. Sympathetic is derived from the thoracic 6 to thoracic 10 spinal segment, and parasympathetic supplied by the right and left vagus nerve. The left vagus nerve supplies the anterior surface or anterior superior surface, and right vagus nerve supplies the posterior inferior surface. So what is the function of the sympathetic supply? The sympathetic supply constrict the pyloric sphincter and relaxation of the gastric musculature, and parasympathetic supply causes the relaxation of the pyloric sphincter and contraction of the gastric musculature, and the pain also conveyed by the sympathetic supply. Okay.
Now the lymphatics. For the lymphatics, we divide the stomach into right 2/3 and the left 1/3 by a line which is extending along the long axis of the stomach. Again, I am saying the stomach is divided into right 2/3 and the left 1/3 by a line which is extending long axis of the stomach. Our left 1/3 again divided into upper 1/3 and lower 2/3. Upper 1/3 drain into the pancreatic splenic node. Lower 2/3 is drain into the right gastroepiploic node. The pyloric part drain into pyloric node. The right 2/3 again divided into upper 2/3 and lower 1/3. Upper 2/3 drain into left gastric node. The lower 1/3 in drain into the right gastric node and the hepatic node. This right gastric node, hepatic node, and the left gastric node ultimately drain into the celiac node, and celiac node ultimately drain into the cisterna chyli.